My family and I emigrated from Constantinople, Turkey in the 50s during the Cyprus incidents. I grew up in Brooklyn, New York, went to school there, and I was studying major in biology. I applied to different medical schools. I was accepted by the Podiatry College here in Chicago, and then I came here, and the rest is history. I've lived here since. Podiatry is from the Greek word podi, and the podiatrist is trained in foot and ankle surgery and orthopedics and diseases and ailments of the foot and ankle.
And now let's go a little bit to the tools that you use.
Well, there's a few lasers out there for treatment of onychomycosis. Lasers have been out there quite a bit for other treatment besides onychomycosis, which is a fungal nail infection. Only recently, just a handful, very few lasers have received FDA clearance, and the Q-Clear by LightEdge is one of the very few that has received FDA clearance specifically for treatment of nail fungus. Generally speaking, what's happening in America, there is a what we call a healthcare crisis. We're hoping that there will be an awakening by the American people, and basically what's happening is that the insurance companies are in it for profit, and although they are providing good care, the premiums continue to go up and the reimbursement to the doctors and the hospitals continues to go down, which pressures hospitals and doctors to be more cost effective, which may or may not lead to better care. Obamacare is kind of a general term, but basically most societies do take care of their poor, and we need to take care of our poor. The problem here is that there's no accountability, and there are some poor that do wish to work and participate and contribute, and there are those that don't, and even among the rich. And so Obamacare has said that everybody deserves medical care, which I don't disagree. However, this needs to be funded wisely and prudently, and we have to have people in charge that are looking more for the welfare of the people in good medical care as opposed to the bottom dollar. Doctors are being forced to see even more patients. In the old days, a doctor could take his time and take 30, 40 minutes to see a patient, an hour. Now you have to see a patient in 10 minutes. So you're forced to see a higher volume, and this can't lead to better care with not being able to be reimbursed for this. So even if the doctor wanted to work for free, certainly his staff is not going to work for free.
Do you think that the system was better before?
Well, you know, the system wasn't necessarily better. It certainly was better for the doctors because they made more money. I don't know if it was necessarily better for the patient. Doctors need to be reimbursed fairly. Don't forget, it's not about money. We're forced into this. You know, you come out, you owe a ton of money for your college funds and everything. Obviously, you're going to try to pick a field that will help you pay for these. If insurance companies could really be deregulated so their margins are really brought down even tighter, and perhaps just getting more doctors involved in insurance panels and in healthcare as opposed to politicians. You know,
what is fair pay? You said it's equal to other trades, and we have free trade, so people can charge whatever they want. So let's say if you're a celebrity doctor, you specialize in something, you may charge 100 times more than somebody else who doesn't have this name. Do you think that this is right, or do you think there should be a limit?
well, you know, it is America, and so, you know, a fool and his money are soon parted. If there's a doctor out there that wants to charge a crazy fee, and there's somebody foolish enough to pay that crazy fee, and I'm not talking about the only man who can save your life, and if you're the only man that could save that person's life, you shouldn't be charging a crazy fee. And so, but what I mean about that is, when you go to a store and you buy something, you take your wallet out and you pay for it. Even if you put something on your credit card, you have to pay for it in 30 days. Whereas when you go see your physician, the physician is reimbursed by the insurance company a certain percentage that may or may not happen, and it's supposed to happen in 21 days, and sometimes it takes 30 or 40. So if there was something where, the physician really knew what he got, and that was across the board, and it was done at an equal time frame, I think that would be approaching market when there's different doctors getting different pay all over the place and different time frames. That's not quite market.